Welcome back to the FHIR and 5. I'm hoping that you're enjoying the series so far. We're up to the letter I. This time around, I've decided to talk about the International Patient Summary, or the IPS. So what is the IPS, or International Patient Summary? It's a document. So it's similar to a HL7 CDA document that we might want to share between jurisdictions, countries, or even just regions. It is an international standard, so it's ISO 27269, and it's a great way of sharing data between, or a common data set between two different countries or two different parts of a country to really understand information, shared information about a patient. So the link at the top of the page there is straight from the HL7 website on IPS, and definitely go there to find out more around IPS. There's a wealth of knowledge there, and it discusses links through to profiles that get used internationally relating to the standard. The key thing around IPS is the data set that's shared. So it's meant to be minimal. It's meant to be non-exhaustive, so extendable. It's supposed to be specialty agnostic. So regardless of the specialty for which the data's covering, it should contain, all of that data. And it's still clinically relevant. So it's really important that the information that's shared between two organisations or two locations can be used to deliver better healthcare for our patient cohort. So this diagram is taken straight from the HL7 website, and thank you for them for creating such an easy to follow diagram of what is in the International Patient Summary and how it's kind of structured. I mentioned that it's similar to a CDA document in the types of data that it's storing. So we need that sort of header level information around who the person is that we're talking about from a patient perspective. Who has authored this document? Who is the attester and the custodian of that data? So that when we share it internationally, we've got some context around, what this document's all about and who it's for and who it's by. There's a set of required elements within an IPS so that we can properly share this information between jurisdictions around medications, allergies, intolerances, and problem lists. So really understanding that clinical context, clinically appropriate context of the data. If we think about wanting to share this information internationally, understanding a patient's allergy intolerances are really important, but also what conditions they may have is key to share that between jurisdictions. In the orange or the yellow there is a set of recommended aspects to the IPS around immunisations, some procedures that they may have had, theatre procedures that they may have had over time. Medical devices, if they were recorded in the sending system, and any diagnostic reports or results that have been generated that are applicable to this summary. So there might be some radiology exams that you want to include as a note as part of this IPS. And then the green, a number of optional sections that can be included to enrich the IPS when we're sending it from sender to receiver, around vital signs, past history, social history. More and more social factors play a massive part in a patient's overall health. And so it's important that just becomes part of that International Patient Summary. Advanced care directives or advanced directives form a part of this as well. So sharing that a particular patient may have a directive in place that you want to share between two organisations or two distinct geographies is really important to form part of the International Patient Summary. This is being used in the wild to transfer information from one jurisdiction to the other. Certainly in the United States, it's being used, but more and more it's being looked at as a data set that can be used when sharing information between the likes of a primary care system and a secondary care or a hospital-based system, where we're wanting to understand the summary of a patient and chunk it down to those components that are really what required from a clinical context to set the scene about our patient and the summary for them. So I hope this has been a good intro into the International Patient Summary. Definitely look at the specifications, look at the ISO standard to see how you might be able to work the IPS into your implementation to get the most out of the patient information that we share, whether it's across one side of one city to another or from one country to another.